Many seniors forget to drink enough water each day, which can cause serious problems for the kidneys and bladder. Doctors warn that dehydration leads to concentrated urine, which can irritate the urinary system and increase the risk of infections. When urine becomes too concentrated, it can make the bladder lining more vulnerable to bacteria, potentially resulting in urinary tract infections that can be painful and, in some cases, dangerous for older adults. Additionally, dehydration can contribute to the formation of kidney stones, which can block the urinary tract and cause intense pain or even permanent kidney damage if left untreated. Staying properly hydrated is a simple yet powerful way to protect the urinary system after the age of 60. Research shows that seniors who consistently drink enough fluids experience fewer bladder issues and maintain better overall kidney function. Adequate water intake helps flush out toxins, dilute urine, and support the kidneys in their natural filtering process. It also reduces the likelihood of bladder irritation, making it easier to maintain regular and comfortable urination. Some doctors recommend that seniors drink at least 6 to 8 glasses of water daily, though individual needs can vary based on health conditions and medications. It's important to remember that thirst sensation can diminish with age, which means that older adults might not feel thirsty even when their bodies need hydration. To avoid dehydration, seniors should make it a habit to drink water throughout the day, even if they don't feel particularly thirsty. Carrying a water bottle, setting reminders, or including water-rich foods like fruits and vegetables in meals can help meet daily hydration needs. By giving the body the water it requires, seniors can maintain healthier kidneys and a stronger bladder, reducing the risk of infections and promoting overall well-being. Holding urine for too long can harm the bladder, kidneys, and overall urinary health, especially in seniors. When the bladder becomes too full, it stretches beyond its normal capacity, which can weaken the bladder muscles over time. This stretching reduces the bladder's ability to fully empty, leaving behind residual urine that creates an environment where bacteria can thrive. Such bacteria can lead to urinary tract infections, which are not only uncomfortable, but also more serious for seniors due to the risk of complications like kidney infections. Some doctors warn that delaying urination repeatedly can cause long-term damage to the bladder's elasticity. When the bladder is unable to contract effectively, it may lead to chronic problems with emptying, known as urinary retention. This condition can cause discomfort, a feeling of incomplete voiding, and an increased risk of infection. Over time, retained urine can back up into the kidneys, leading to a condition called hydronephrosis, which can damage kidney function and cause pain. Research also shows that seniors are more likely to ignore the urge to urinate, especially at night or when they're away from home. Some seniors do this out of habit, while others worry about finding a restroom in time. However, ignoring these urges too often can train the bladder to hold urine longer than it should, which makes the problem worse. Frequent voiding, on the other hand, helps maintain the bladder's natural function, prevents overstretching, and reduces the chance of infections and kidney problems. Doctors recommend that seniors respond promptly to the urge to urinate, even if it feels inconvenient. It's also advised to plan bathroom breaks at regular intervals, such as every 2 to 3 hours during the day, to avoid overstretching the bladder. Maintaining good hydration helps dilute urine, making it less irritating to the bladder lining. By paying attention to the body's natural signals and avoiding the habit of holding urine too long, seniors can keep their bladder healthier, reduce the risk of infections, and support overall urinary health. Smoking irritates the bladder and increases the risk of developing bladder cancer, making it especially important to stop this habit after the age of 60. Studies have shown that smokers are at least 3 times more likely to develop bladder cancer compared to non-smokers. The harmful chemicals in tobacco smoke, including carcinogens, are absorbed into the bloodstream and filtered by the kidneys before being excreted in the urine. These chemicals can linger in the bladder, where they irritate the lining and create an environment conducive to the growth of cancer cells. Some doctors warn that the bladder's lining is particularly sensitive to the toxins found in cigarettes. Continued exposure over time can cause changes to the cells, leading to the development of tumors. These tumors can obstruct the flow of urine, cause pain, and require invasive treatments that are especially challenging for older adults. Even if cancer does not develop, smoking can still irritate the bladder and worsen symptoms of urgency, frequency, and incontinence. This can significantly affect quality of life, as many seniors already face bladder control issues due to aging. Research also indicates that smoking reduces the body's ability to fight infections. This means that smokers are more likely to develop urinary tract infections and experience slower healing times. For seniors who are already at higher risk of infections and complications, this adds another layer of concern. Additionally, smoking can damage blood vessels and restrict blood flow, further contributing to kidney problems. Some doctors emphasize that the kidneys play a critical role in filtering waste products, and any damage to these organs can lead to serious health issues, including chronic kidney disease. Quitting smoking can significantly reduce the risk of bladder cancer and improve overall urological health. Studies show that the risk of bladder cancer begins to decline soon after quitting, although it may take several years for the risk to approach that of a non-smoker. Doctors recommend seeking support through counseling, medication, or support groups to increase the chances of quitting successfully. For seniors, stopping smoking not only benefits the bladder and kidneys, but also enhances overall health, improves circulation, and boosts the immune system. By quitting this habit, seniors can take a critical step toward protecting their urological health and enjoying a better quality of life. Both caffeine and alcohol can irritate the bladder, leading to increased urgency, frequency, and dehydration, which can disrupt normal urinary function in seniors. Some doctors caution that caffeine, commonly found in coffee, tea, and sodas, acts as a diuretic, which means it encourages the body to produce more urine. This increased urine production can overstimulate the bladder, making it harder to control urges and contributing to more frequent trips to the bathroom. For older adults, this can be especially troublesome at night, disrupting sleep and contributing to fatigue during the day. Alcohol also has a diuretic effect that can further complicate bladder health. It reduces the body's antidiuretic hormone levels, leading to even more urine production and the potential for dehydration. Dehydration concentrates urine, which can irritate the bladder lining and create an environment where bacteria are more likely to thrive, increasing the risk of urinary tract infections. Seniors who already experience bladder control issues may find that alcohol worsens symptoms like urgency and incontinence, making daily activities more challenging and uncomfortable. Research shows that limiting or avoiding excessive caffeine and alcohol can significantly improve bladder control and reduce the risk of irritation and infections. Some doctors recommend that seniors limit coffee and other caffeinated beverages to no more than 1 or 2 cups per day and avoid drinking alcohol close to bedtime to prevent nighttime urgency. By doing so, seniors can reduce the strain on their bladder muscles, allowing them to hold urine more comfortably and empty more effectively when needed. In addition to direct effects on the bladder, both caffeine and alcohol can contribute to dehydration, which in turn makes urine more concentrated and acidic. This can irritate the urinary tract and increase the risk of kidney stones, a painful condition that can require medical treatment. Staying well hydrated by drinking water and reducing or avoiding these beverages helps maintain a healthy urinary system and supports the kidney's ability to flush waste from the body. By paying attention to these drinks, seniors can improve bladder health, maintain better control over urinary urges, and enhance overall quality of life. Reducing excessive caffeine and alcohol is a simple yet powerful step toward protecting the bladder and ensuring comfort and confidence in daily activities. Many seniors overlook the importance of regular prostate health checks, which can lead to missing early signs of conditions like benign prostatic hyperplasia, BPH, and prostate cancer. Prostate health is a crucial aspect of aging, as the prostate gland tends to grow larger with age. Some doctors warn that this enlargement can cause urinary problems, such as difficulty starting urination, a weak stream, or a feeling of incomplete bladder emptying. These symptoms, while common, can also be early signs of BPH, a non-cancerous condition that can be effectively managed if detected early. Prostate cancer is another concern that becomes more significant after the age of 60. According to research, prostate cancer is one of the most common cancers among older men, and its early stages often present no noticeable symptoms. This means that many seniors may not realize they have the disease until it progresses and becomes harder to treat. Doctors emphasize that early detection through routine screenings, such as a prostate-specific antigen, PSA, blood test, or a digital rectal exam, DRE, can greatly improve outcomes by identifying the cancer before it spreads beyond the prostate gland. Some seniors may avoid these checks due to embarrassment, fear, or misconceptions about the procedures involved. However, medical experts highlight that regular screenings are simple and can be done during a routine doctor's visit. These tests can help distinguish between benign conditions like BPH and more serious issues like cancer. Early treatment options for BPH might include medication or lifestyle adjustments, while prostate cancer treatment could range from active surveillance to surgery or radiation therapy, depending on the stage and overall health of the patient. Ignoring. Prostate health can lead to complications, including urinary retention, infections, and, in the case of cancer, potentially life-threatening outcomes. By making prostate health a priority and having open conversations with healthcare providers, seniors can take a proactive role in maintaining their quality of life. Routine screenings help detect problems early, allowing for more effective treatment, and reducing the risk of complications that can significantly impact daily activities and independence. Addressing prostate health regularly ensures that seniors stay informed about their risks and options, empowering them to make decisions that support a healthier, more comfortable life. Seniors often rely on painkillers to manage arthritis or back pain, but overusing these medications can damage the kidneys and lead to urinary problems. Some doctors warn that non-steroidal anti-inflammatory drugs, NSAIDs, like ibuprofen and naproxen, while effective for pain relief, can reduce blood flow to the kidneys, leading to decreased kidney function over time. This can affect urine production, making it harder for the body to filter waste and maintain a proper balance of fluids. Research has shown that when the kidneys are stressed by frequent use of painkillers, they may not be able to remove toxins effectively. This buildup of waste in the body can contribute to an increased risk of urinary tract infections, a condition that can be especially challenging for seniors. Seniors with existing kidney concerns or high blood pressure are at even greater risk of kidney damage when using painkillers too often or at high doses. Doctors often recommend using painkillers only as needed and exploring alternative treatments for chronic pain, such as physical therapy or lifestyle adjustments, to reduce reliance on medication. For seniors who must use painkillers, medical experts suggest taking the lowest effective dose and avoiding long-term use whenever possible. Regular checkups can help monitor kidney function and catch any problems early, before they develop into more serious issues. Overuse of painkillers can also mask underlying conditions that need attention. Ignoring or self-managing pain without medical guidance can lead to complications that may affect mobility and overall well-being. By being mindful of painkiller use and staying informed about potential risks, seniors can better protect their kidneys, support healthy urine production, and lower their risk of urinary infections. Weak pelvic floor muscles can significantly affect bladder control, leading to embarrassing leaks and a loss of confidence. Many seniors underestimate the importance of maintaining pelvic floor health, often skipping exercises that could improve strength and function. Doctors explain that the pelvic floor muscles support the bladder, urethra, and other organs in the lower abdomen. When these muscles are weak, it becomes harder to control the flow of urine, increasing the risk of incontinence. Research has shown that seniors who neglect pelvic floor exercises may experience a decline in bladder control over time. This can result in frequent trips to the bathroom, urgency, and accidents that disrupt daily life. Doctors often recommend simple pelvic floor exercises, sometimes known as Kegel exercises, to help seniors maintain or regain muscle strength. These exercises involve contracting and relaxing the pelvic floor muscles in a controlled way, which can improve coordination and endurance. Ignoring the pelvic floor can also have a negative impact on mental health, as incontinence often leads to social withdrawal and reduced participation in activities. Seniors who experience incontinence may feel embarrassed or anxious about leaving the house, which can diminish their quality of life. According to medical experts, even a few minutes of pelvic floor exercises daily can make a meaningful difference in bladder control and confidence. Some studies have found that seniors who regularly practice pelvic floor exercises report fewer episodes of leakage and a greater sense of control over their bladder. Doctors emphasize that it's never too late to start these exercises, and many seniors find that with consistent practice, their symptoms improve. It's important to learn the correct technique to get the full benefit, which is why many healthcare providers offer guidance or refer patients to specialists who can teach proper pelvic floor exercises. Taking care of pelvic floor health is a vital part of maintaining independence and dignity in the senior years. By prioritizing these muscles, through daily exercises and not ignoring them, seniors can reduce the risk of incontinence and enjoy a more active, confident life. A high-sodium diet can place unnecessary stress on the kidneys, leading to potential complications like water retention, urinary infections, and even kidney stones. Many processed foods contain large amounts of added salt, which can easily exceed the recommended daily intake without much notice. According to health experts, seniors who consume too much salt may experience higher blood pressure, which in turn can damage the delicate structures within the kidneys that filter waste and excess fluid from the body. When the kidneys are overworked, due to excess salt, they may become less efficient at maintaining proper fluid balance. This can lead to water retention, which not only contributes to swelling in the legs and ankles, but can also dilute the urine, creating an environment that encourages the growth of harmful bacteria. These bacteria can cause urinary tract infections, which are especially problematic for seniors, as they may lead to more serious complications like kidney infections, if not treated promptly. Doctors warn that a diet high in salt can also increase the risk of kidney stones. When the body struggles to manage sodium levels, it can alter the balance of minerals in the urine, making it easier for calcium and other substances to crystallize and form painful stones. Seniors who develop kidney stones often experience severe pain and may require medical procedures to remove or break down the stones. To reduce these risks, experts recommend reading food labels carefully and choosing fresh, unprocessed foods whenever possible. Studies suggest that reducing salt intake can help protect kidney function and improve overall urinary health. By being mindful of dietary choices and focusing on lower sodium options, seniors can help maintain their kidney health, reduce swelling, and lower the likelihood of infections or stones that can impact daily life. Making this adjustment may take time, but the benefits of supporting the kidneys and urinary system are well worth the effort. Regular urological screenings after 60 play a crucial role in maintaining good health. These checkups help identify problems like urinary tract infections, bladder dysfunction, and even early signs of cancer before they progress into more serious conditions. According to some doctors, seniors who avoid these screenings miss the opportunity to catch diseases at their earliest and most treatable stages, potentially leading to severe complications that affect the kidneys, bladder, and overall urinary system. One of the most concerning issues is that many seniors might not feel or notice symptoms of urological problems until the condition has worsened. For instance, bladder cancer can develop quietly, with symptoms like blood in the urine often mistaken for less serious concerns. Without regular checkups, seniors may ignore these signs or dismiss them as part of aging, allowing the disease to advance and become more difficult to treat. Doctors emphasize that early detection can significantly improve outcomes, making routine screenings an essential part of preventive care. Skipping medical checkups also increases the risk of chronic kidney disease, a condition that can gradually damage kidney function and lead to serious health problems, including the need for dialysis. Regular monitoring of kidney health through simple tests can alert healthcare providers to changes in function early, enabling them to recommend lifestyle changes or treatments that slow the disease's progression. By prioritizing these appointments, seniors can help ensure they're giving their urinary system the attention it deserves, maintaining both their independence and quality of life. Making medical checkups a routine part of senior health empowers older adults to take control of their well-being and avoid preventable complications.